Hey, good morning, everybody. Great to see everybody out bright and early. One of the amazing things I've learned about this meeting is you get the benefit of so many different perspectives. And it's really part of the magic that makes this organization and this meeting for sure. And we hope to start off the day right with a different perspective here, as Stephanie said. I'm a survivor for a couple of years now. In my time of need, BCAN was there for me. So I'm really fortunate to be here today to contribute back to this community in a little bit different way. Today you're going to hear from emerging healthcare professionals who have an interest in drug development, in new drug commercialization. It's amazing. I know yesterday we heard a little bit about clinical research, and we will for the rest of the meeting, I'm sure. That's a big part, but it's part of a bigger process that pharma companies undertake to bring a new medication to market and meet unmet needs. So you're going to hear about the journey of these student pharmacists in a little bit and how they helped raise awareness of bladder cancer, of patient advocacy organizations, patient advocacy groups, and also the unmet needs that this community tries to tackle really every day. There we go. I'm Jim Alexander. I'm the CEO and founder of this professional organization, the Industry Pharmacists Organization. On behalf of our 26,000 pharmacists in our community, pleased to be here today to represent them. They all have a passion for drug development and commercialization. As you think about it, think Pfizer, quote unquote, rather than CVS or Walgreens. And there's a good number of us who dedicate our careers and our energy towards that end. We also have 100 student chapters, which I'll tie in here in a minute. It's a really vibrant community. I guess there's about 140 pharmacy schools in total, and we have a presence at a lot of them. So I'm here today to introduce a case competition, and you're going to hear more about what that is from the representatives of the winning team. It's a hypothetical drug development contest for all of our chapters nationwide. So we come up with a concept, and they develop and present to us a drug development and commercialization plan. It's a big undertaking for everybody in our community, and the result of that is got to press hard, sorry. Not so big reveal maybe after you heard a little bit about my background, but I'm a pharmacist, supposedly a medication expert, or I was at one time, but here I am in my time of need with this disease, and I'm looking around, what, no drug for me? And surgery ended up being my answer. But used my station and convinced everybody that this year we should focus our case competition on advanced bladder cancer disease. So given my interest in that space, everybody worked on helping meet the unmet needs. And we'll learn more about the actual profile of the molecule in a little bit from our winning team. And we did try to communicate, the patient is waiting. There's a lot of unmet need in this space. And, all of our teams work towards that. So I went to Stephanie Chisholm, and I said, Stephanie, this is our organization. Here's what we want to do. What do you think? Thankfully, she embraced it, and enthusiastically we worked on that together for really a year, Stephanie, right, from start to finish. So we partnered with BCAN and IPhO on the development of the case, on how are we going to heighten the awareness of bladder cancer, patient advocacy groups, and these unmet needs that we're all working on. And then, yes, to train the next generation of healthcare professionals and build their awareness in this space. So after 6 months of hard work by all of our team, there are 72 chapters that completed the competition, 800 students. Really, the community is much larger when you count everybody who's involved in administering, assessing, and so on. We selected and announced the winners earlier this year. University of California, San Francisco was the first place winner, and they're here to share their journey with you in just a moment. As I leave the stage, I'm just going to say thank you to Stephanie, the BCAN team, and the community giving me and our organization this opportunity. Again, provide a different perspective for you. Shout out, I see Gail, I think Daryl's here too. They shared their journeys with all of our students, and that was amazing and impactful, so thank you for that. Thankful to the 800 participants, as I said earlier, and to CGen and Astellas for providing the support to BCAN, ongoing support, and also for this competition. And if I can get this to work. Yeah, thanks to all of them. And I'm going to invite now, thank you all. I'm going to invite up to the stage Michael Harrison from CGen, and he was a collaborator as well, an advisor, and he's going to introduce our presenters from the University of California, San Francisco. Thank you. Come on up.
Good morning, everyone. Thank you, Jim, so much. I'm Michael Harrison. I'm a pharmacist by training. Go Blue, et cetera, et cetera. It's really been an honor to work with Jim, work with the BCAN team, work with Stephanie, and really it's been an honor to really see all of these students grapple with really, really tough problems and come up with creative and interesting solutions to those, with really the goal of trying to bring, recognize the unmet need for patients with bladder cancer and, imagine how they might bring a drug, to these patients to meet that. Hopefully I was not too harsh a judge for this competition, but again, I'm so proud of everything, these 800 plus students were able to accomplish as part of this, really all of, everything that they learned and recognizing that these are rising healthcare providers and maybe some of them will be treating bladder cancer someday. So I am so proud to introduce the representatives from UCSF, Amelia and Noor. Can I get a round of applause for them to walk us through their journey?
Thank you so much, Jim and Michael. And hello, everyone. We are so honored to be here today to present at the BCAN Think Tank. My name is Amelia Lau. I'm joined by my colleague, Noor Al-Warshawi. We're both final year pharmacy students at UCSF. So let me see if I can get this to work. Okay, that's us. All right. So this past year, we were the co-leads of a pharmaceutical company called Pharmacists Pharmaceuticals, which was actually a completely fictional company that we created for the purpose of the IPhO VIP case competition. Being tasked with developing a hypothetical drug from scratch was a really daunting hill to climb. So we want to take you along the journey of how we navigated this challenge over the past 6 months of the competition. Working backwards, we first want to show you the final product that our team created, which was Metaprev, a drug for patients with locally advanced or metastatic urothelial carcinoma with FGFR3 mutations. As you can see in the slides here, our drug boasts prolonged survival rates, better tolerability, and even an associated non-invasive diagnostic to help determine if patients are eligible for this therapy. When it comes to developing a hypothetical drug, we were aware that we could make it perform in any way that we wanted it to. So how did we land on Metaprev? That's the story that we want to share with you today, and that story begins and ends with the patient experience. So what did we have to start with the competition? Really, it was just a rough timeline that outlined the major milestones and deadlines. And given this timeline, we were able to break down the competition into different strategic stages. We knew that our first priority would be to build a strong team that would function well in this very fast-paced simulation. So about a month before the start of the competition, we recruited 19 other talented pharmacy students that were distributed across different functional areas of the team. And then in early October, IPhO released the official case, and we attended a BCAN patient webinar where we were really privileged to hear from patients Gail and Daryl, who are here with us today, to really gain an understanding of the experience of patients affected by metastatic urothelial carcinoma, or I'll refer to it as mUC. In this startup phase of the competition, we really sought to gather as much intel as possible on the disease state before we could then move into the early strategy phase of the competition to outline a clear vision of our drug before the midpoint submission. And then in the late stage of the competition, before our final submission, we were given a challenge point prompt by IPhO, which was essentially a challenge designed to mimic the unpredictable nature of drug development. This required adjusting our strategy and incorporating new elements into our final presentation. So now I'll begin walking you through each phase of our process, beginning with the startup phase. So our team had a few major priorities for the startup phase. First, obviously, we had to gain familiarity with the drug development process itself, which included understanding the functional areas contributing to the process, as well as the factors that play into successfully bringing a drug to market. So for many team members, it was actually the very first time learning about the pharmaceutical industry, so there was a bit of a steep learning curve. To overcome this challenge, we equipped the team with some professional industry mentors that provided us continuous guidance throughout the course of the competition. In the startup phase, mentors from each functional area delivered a presentation on the nuances of their functional area so that our team could be aligned at a baseline level of understanding of the process before proceeding in the competition. Our second goal was to build a strong understanding of the disease that our hypothetical drug was meant to target. Mastering a disease state can be a pretty challenging endeavor where you need to establish a holistic understanding of not only the scientific, medical aspects of the disease, but also the management options, guideline recommendations, and treatment landscape and competitive landscape. The primary purpose of this research was to identify the unmet needs in mUC that could be filled by our hypothetical drug. So how did our team tackle this task? We ended up taking a pretty multifaceted approach that encompassed reading published literature, hearing directly from patients affected by the disease, and speaking with practicing physicians that treat the disease. As I mentioned, an impactful event that really shaped our goals was the BCAN patient webinar, where bladder cancer survivors shared their personal journeys. We found that engaging in this webinar, as well as discussing the gaps in treatment with practicing physicians, gave us insight into the real burden of the disease and the challenges that patients and clinicians are facing. So throughout this research process, we really sought to have these fundamental questions answered. At the top, and most importantly, what matters most to patients? Next, what improvements are providers hoping to see? What is needed for reimbursement by payers? And finally, what are the goals of future therapies? The entirety of our research enabled us to paint a full picture of the unmet needs in mUC. We learned that there are many drugs and combinations of drugs used in treating mUC, and each of these regimens have their own pros and cons. Ultimately, the ideal drug is one with high efficacy and long-lasting effects, mild and manageable side effects, easy administration, and low cost, of course. Unfortunately, the current drugs used in mUC don't yet meet these criteria. As emphasized by Gail and Daryl at the BCAN patient webinar, some of these drugs can have side effects that make it difficult to adhere to their treatment. They also noted that they really appreciated when they could take their medications orally, as infusions are not only physically burdensome, but a pretty significant time commitment. Another cited aspect of treatment burden was the invasive tests required prior to even receiving the therapy. And finally, for those who worsen on or don't respond to the standard of care chemotherapy, there unfortunately aren't too many other good options to manage their disease. So at this point, we have done about 4 weeks of intensive background research, and we're ready to jump into our development strategy. So since this was a competition simulating drug development, we were actually able to selectively choose the unique characteristics of our drug based on our identified unmet needs so that our drug could address these gaps. At the same time, we wanted to ensure that our plan would be feasible to attain in the current state of drug development. So shown here on the top left is our hypothetical drug's molecular structure, which is a modified form of FGFR3 inhibitors used in mUC. And on the right is our drug's molecular mechanism. Our drug was designed to possess selectivity for the FGFR3 drug target, theoretically allowing for minimal off-target effects, demonstrate potency against target mutations to allow for a longer duration of response, and be delivered orally. So these features would then be tested and validated in our hypothetical clinical trials. Our next challenge was for our clinical development team to design our clinical trials to demonstrate the safety and efficacy of our hypothetical drug. So in designing our trials, we had to take into account regulatory considerations to determine how to most efficiently design our studies to receive potential early approval of our drug. We also needed to design our studies in a realistic way to thoroughly characterize the safety, efficacy, and other properties such as the PK of our drug. So there were quite a few considerations to do so. First, we needed to ensure that our study populations were representative of the true demographic of mUC to be able to conclude that the results from our studies would be applicable to real-world patients. So in real life, this might entail partnering with patient advocacy groups to enroll patients in the study and launching diversity and inclusion initiatives involving the engagement with communities where the disease may be more prevalent. We also had to ask questions like, what are the criteria for inclusion and exclusion in our study to specify exactly who would be included in our studies? And also, what are appropriate endpoints for safety and efficacy to evaluate how our drug was performing? Our regulatory plan for obtaining FDA approval was developed in conjunction with our clinical development plan, which really reflects the parallel process and cross-functional nature of drug development in the real world. So the goal of regulatory is to obtain FDA approval as quickly as possible while also negotiating the prescribing information that details the evidence of use for our drug. So our regulatory team's task was to determine how to move our drug from point A of the investigational new drug application leading to the initiation of clinical trials to point B of the new drug application leading to FDA approval. So our team had to consider the requirements and implications of each of the expedited pathways that we could utilize. We also had to outline the precise timelines for meeting with the FDA as well as filing applications. And we also had to determine what specific data is actually required to be granted FDA approval. So much of our strategy was based off of regulatory precedents with previously approved similar drugs for which we analyzed their regulatory documents and timeline to model our own approach. Next, our medical affairs team was tasked with determining how to best disseminate our data and educate our stakeholders on the evidence of use for our drug. So we first needed to understand who our stakeholders are. So that includes our internal stakeholders or individuals within the company, and our external stakeholders, which includes everyone from patients to providers, payers, government agencies, and patient advocacy groups like BCAN. We learned that this dissemination of data is very, very crucial to the market success of the drug, and without the functional medical affairs, many patients wouldn't even be able to receive the drug regardless of FDA approval. So it was the goal of our team to not only identify the important stakeholders, but to also devise plans to communicate and educate through publishing in journals and presenting at conferences, building relationships with prominent physicians, and developing informational and educational resources. So our team members dedicated a lot of time to researching the relevant journals and conferences to target, as well as urologic oncologists to designate as our key opinion leaders for a product in order to build out our comprehensive medical plan. And finally, once our hypothetical drug was on the market or soon to be on the market, our commercial and marketing team came into play to address the goal of maximizing uptake of our product, ensuring that patients that would benefit from it receive it, or at least are given the option to receive it. So our team focused their efforts on performing research on the target market and health plans, strategies to expand knowledge of the data, and analysis of competitor clinical status, market success, and their marketing strategies. So as part of our team's marketing strategy, we developed numerous patient and provider-centric resources dedicated to providing educational resources, support functions, and other tools to manage the patient's conditions. As you can see here, we have an app and a website that our team designed. And now I'll hand it over to Noor for the remainder of the presentation.
Thank you so much, Amelia, and thank you all for joining us today. So with our early strategy finalized, our team was empowered to move forward into developing our late strategy to ensure the success of our drug on the market. A big component that determines the success of a drug once it hits the market is something that we call in the industry guideline placement. Guideline placement basically describes the exact place in therapy in which a certain drug is used, and the higher a drug is ranked within a treatment algorithm, typically that correlates to how well it performs on the market and what its uptake will look like. So how exactly did we advocate for an advanced place in therapy? Our team focused on 4 main points to anchor our action plan. First, we targeted first-line guideline placement by conducting studies that demonstrated the superiority of our product. Everything begins and ends with patient safety, so our patient safety data reflects better tolerability, and that translates to a safer drug overall. Sorry. Next, we wanted to intentionally select drugs to test in combination with our product that would highlight its efficacy. Choosing drugs to test in combination relies on a variety of factors like adverse effects, efficacy, mechanism of action, and accessibility. And so based on the favorability of these factors, we landed on Keytruda, also known as pembrolizumab, and that was the drug that we decided to run in combination with our product. And lastly, continued verification is a key element in protecting the success of our product. Without thorough investigation and an open approach to responding to patient and provider requests, there is really no way to grow after a drug hits the market. Maintaining open lines of communication with patient and provider communities alike allow us to respond to requests from both members of both communities, and also allow us to understand what post-marketing studies to run, and allow us to plan out our next steps as a team. So the journey of developing a drug does not stop at approval. Drug companies have to develop post-marketing plans so that there's a structure for responding to those provider requests and a plan that will support the product's continued success. So this involves investigating what other indications may be applicable to our product so that we can extend its life cycle by expanding its applications. It also involves continued safety surveillance regarding patient-reported side effects and conducting provider-driven post-marketing studies to fill in any gaps in our information. Generating real-world health economic outcome research evidence will also help us expand our market access and increase product accessibility for our consumer base. And lastly, keeping those lines of communication open to the provider and patient communities as they prescribe and continue to use our product allow us to monitor critical feedback and make improvements. So as our team was working diligently to develop our drug and prepare for our final deadline, we were notified of a new hurdle in the road about 3 weeks out from our official deadline date, and that's something called Challenge Point. So Challenge Point is basically a late-stage wild card that IPhO was assigned to all the teams. It's a completely new prompt or task that all the teams have to participate in and incorporate into their final presentation. This addition emphasizes that the drug development process is unpredictable and nonlinear, and so this year we were given a 2-pronged prompt to address. The first half was to examine the competitive landscape and to select 3 suitable therapies that could be used in combination with our product. As a team, I'm proud to say that we were able to anticipate this ahead of time, so we already baked this into our development plan. And the second half was to evaluate how our team plans to interact with patient advocacy groups such as BCAN before and after our product obtains approval. And so for the purpose of this presentation, this is going to be the half of the prompt that we're going to focus on. So pre-approval, the relationship with patient advocacy groups can inform early strategy decisions. As we mentioned in the beginning, a pivotal moment in this competition for our team was hearing the experiences of real patients such as Gail and Daryl who had taken drugs like our drug to treat their cancer. So these stories really helped us understand what we wanted to accomplish with our drug and helped us kind of confirm and finalize what our ultimate goals of therapy should be. Post-approval, continued interaction with patient advocacy groups aids in the development of patient-centric tools that are designed to facilitate more seamless communication between patients and providers. So this really should help patients when it comes to reporting side effects, asking questions, verifying information. So what does partnering with a patient advocacy group specifically look like? This was our plan to establish a relationship with BCAN. Since mUC is categorized as a rare disease, BCAN was actually vital in helping us recruit patients for our clinical studies. However, the patient advocacy group involvement does not stop there. From creating a clinical trials dashboard to help patients and providers navigate clinical trial sites, to increasing disease awareness through various community education programs, to directly conversing with patients and providers to receive constructive feedback, we wanted to create a comprehensive approach that puts the patient experience first. Along with these efforts to improve patient outreach, our company also wanted to create opportunities for patients' voices to be heard, such as hosting town halls so patients can directly engage with our company and share their insight and experiences. We also developed a patient guide that provides specific information regarding what to anticipate when using our therapy so that patients have a simplified source of information to start them on their journey. Now, moving on to our last steps prior to submitting our final product, we also wanted to share with you all the strategies we use to optimize our team organization and collaboration. So while our team overcame many obstacles, as we've discussed throughout this process, sometimes the hardest challenge involved uniting our group. As we mentioned, our team this year encompassed 21 extremely talented individuals, all with very unique sets of skills, backgrounds, and experiences. But sometimes a team so large can be challenging to unite. Remedying conflicting opinions can pose a very unique obstacle, and some conflicts we experienced involve challenges delegating roles as a large group, deciding on a single course of action to move forward with, and maintaining consistency between our 4 functional subgroups. Ultimately, Amelia and I learned several major lessons when it comes to leading a team like ours. The first is that different roles lend themselves to conflicting opinions at times. Clinical development would inevitably have different priorities than regulatory affairs, for example, and this was reflected in how our mentors would advise us as well. However, we found that coordinating team bonding activities and leading live discussions helped cultivate a safe space where we could challenge each other to find the best solution. It was only when we were able to achieve alignment that we found we experienced the best success, not just within the competition, but also in how we communicated as a group and worked together towards a common goal. Sometimes communication is more about listening than it is about speaking, and we found that taking the time to listen to everybody's ideas and allowing them the space to let their voice be heard gave us a better understanding of our team and how to navigate them towards success. So it goes without saying that the experience of leading such a dynamic team such as ours was an amazing opportunity, but there were some key takeaways that made the largest impact on us that I'm sure we will carry with us throughout the rest of our professional journeys. The first is that this competition encapsulated a complex and nonlinear process that relies heavily on the collaboration of many groups. The skill that proved to be most valuable to us was our ability to be flexible. Unpredictable challenges presented themselves at every step, and without the willingness to pivot and restructure, we wouldn't be here presenting to you all today. There were many instances where we had to entirely scrap our development plan and go back to the drawing board yet again, but we were all very committed to the learning process and to producing the best product we could, and so that united us against those challenges and allowed us to deliver a high-level product at the end. I also want to remind you all that our project was entirely fictional. Our drug company does not exist. Our product is very fake. Our data is completely fabricated to be as favorable as possible. So really, this was a simulation that just barely scraped the surface of what this process really looks like in real life. However, the biggest takeaway today is that in reality as well, this is a process that is motivated by patient needs every step of the way. Through this complex and integrated process, we were exposed to so many elements of drug development. These elements can really vary in their role and function, but as I mentioned, something that unites them across the board is their dependence and devotion to the patient experience. And that is what drives innovation and motivates drug development teams to find solutions for patient-reported problems. And with that, we want to thank you all for your time today and your attention as well. It has been our honor to present our work to you. And we want to acknowledge that although you only see 2 of us on stage, this would not have been possible without the hard work of our incredible team, who we wish could have all been with us today. For the members of our team that are here, we want you guys to stand up so you guys can be recognized by the group in the room as well. And we also want to especially thank the efforts of Slade Schneider, who is our chapter president of IPhO at UCSF and our head of clinical development as well. His leadership was exemplary throughout this entire process, and he helped us navigate some very challenging obstacles.
Want to keep moving. Stay
Yeah, thank you all for your attention. Thank you to IPhO, BCAN, CGen, and Astellas for their continued support of this competition and of our work. And we just want to emphasize that without you all here today, journeys like this would not be possible. So thank you so much.